Why aren't my TV showing? Hmm.
All right, good afternoon, everybody. We are at that time of the day. It's a little bit after 11:30, so let's call ourselves to order. Opioid Settlement Fund Task Force for May 1st. Next item is for our roll call. Clerk.
All right. Chair Strubs,
Present.
Commissioner Ray, Commissioner Hepler, Commissioner Morales,
Present.
Health Officer Rutherford,
Present.
Director Nettleton,
Here.
Director Bobo,
Here.
Sheriff Fuller,
Present.
Administrator Green, Director Gray,
Present.
Ms. Davis, Ms. Stortablu,
Present.
Ms. Ford. Present. Dr. Ford. Dr. Ford. Sorry. Ms. Henry. All right, Mr. Gray.
Present.
The other Gray.
Oh, there's another one?
Yes, Mr. Leroy Gray. Mr. Gladstone.
Present.
Ms. Anders.
Somebody else has it.
All right. Thank you.
All right, thank you. I will share it. We've received communications from Miss Anders, Miss Reed, Miss Henry as well, and Chair Ray that they would not be in attendance today. So their apologies were sent to us, but we will continue our work.
Madam Chair, quick question.
Yes, Mr. Gladstone.
Have we ever established if we need a quorum, or are we voting, if we ever vote on anything, have we established a quorum?
Thank you for that question. Administration, do you have any insight as to, for ad hoc committee? We have no items before us for vote today, but.
As the ad hoc committee, you follow the Board of Commissioners bylaws and what's established there to have a quorum.
Thank you. Pardon me, Mr. Gladstone?
I'm sorry, you have more people than your commissioners on this task force, so I don't know what those numbers look like.
A quorum would be a majority of the body.
Just a majority.
Yeah.
Gotcha. Thank you.
Yes, thank you. Thank you for elevating the question. All right, with that, we're going to come to item 3, review and approval of the minutes. I suppose we do vote on our minutes. Any comments or concerns on the provided minutes? If not, I'd entertain a motion for their approval.
Second.
Moved by Director Rutherford and seconded by Mr. Gladstone. Any further discussion? All those in favor of the approval of the minutes signify by saying aye. Aye. Any opposed? Motion carries. Approved minutes. Thank you so much. Item 4 brings us the opportunity for public comment. So this is a time for members of the public to come and talk with members of the task force. You have up to 4 minutes. You're welcome to come to the podium, or if you are participating online, you can raise your hand, and we would love to hear from you.
Thank you.
Wonderful. Will you please just provide us your name for the minutes and feel free to share your comments. Go ahead.
Sure, I'm Jennifer Fackety. For the minutes, it's Faketty. And I am here on behalf of the Alano Club of Kalamazoo. You may or may not be familiar with us. We are a 501c3 who's located at 933 South Burdick, so right down the road, convenient to downtown. And we house 12-step meetings for recovery. We have like, I think 45 at least meetings a week. We're between 5 and 8 meetings a day. And our club is open from 9 a.m. until probably about 8:45 at night for suffering addict or alcoholic to come and have a place to be that's safe from drugs and alcohol, people who can help them. And I just want to let y'all know that we're there. And we've been there since 1968. And we serve a lot of a huge population. And I'm sorry, I do not have numbers about the people the courts actually send us. And we could really use your support. A lot of the people that come in there, I mean, obviously we're talking about people who are suffering from drug addiction and alcoholism, and they're not going to become a member of the club, or you know what I mean? Like they're not adding any additional funding or support to us, to our building. And that building is a place where they can find hope. It is a place where I found hope, and there may be a couple other miracles sitting here in this room today. Yeah, the 12 steps does work for addiction and alcoholism and any of the other things. We also have support. We have some meetings that support the families of addicts too. So we're just really a place where many different members of the community can find support for the crisis that we're in right now. And so I just am here to let you guys know that we're out there. I've never done this before. I still have a minute and a half. I think I'm good. So yeah. Money, like, yes, we do need money. I can't tell you. I don't know did I say that I'm on the fundraising committee? So I'm the chair of the fundraising committee. Sorry. I'm the chair of the fundraising committee, and we're kind of a new committee. We started maybe a year ago. And we're trying to, so right now we've done a few things with a few small events, and we've got a grant writer on our committee now also. So we've gotten a couple of grants, which have been nice. And we did get a couple of larger donations last year, but that's really where our money is coming. We're not pulling money from the people that we serve. And so it's kind of hard. And right now we just found out that we could possibly get some help here. And so that's why I'm here to ask you for help in supporting our mission. And we're fairly new, so maybe I'll see some of your faces in other meetings. I don't know. But we're excited to be here, and we're grateful for any help that could be given us. Thank you so much for your time.
Thank you so much. Any other members of the public that wish to address the task force? Yeah, great. Thank you.
I don't do this all the time either unless I'm talking to a bunch of drunks, but I'm here to represent the Alano Club of Kalamazoo as well as Jennifer. And my name is Terrence Sullivan. And I'm the president of the board of the board of the Alano Club. And we have in the past, since COVID hit, I guess, a lot of things have happened in the last number of years. A lot of people have chosen to go out and do stupid stuff. And so we've seen an influx of folks coming to the Alano Club. And in the past, like when I first started out, because I am one of those people that need the Alano Club, and that place saved my life. And there's a number of people that feel that way. And it used to be I had the gift of desperation, like I was going to do this or I wasn't going to be around. And so I look at the Alano Club as a place that saved my life, literally. And there's a number of people that I come into contact with that feel the same way. However, if you had the gift of desperation, that's one thing you're more committed to it. You take somewhat of an ownership. And if you have the gift of inconvenience, as in the judge sending your butt down to the AA meetings and you got to come there, we've seen a lot of that type of thing, and that we embrace that. You know, people come down, a lot of folks are angry and they're resistant to any thought of getting better. And so they come in and go out, but while they're at a meeting, we used to be, and that is our goal, to maintain that, to be self-supporting through our own contributions. But in the past months, years, I guess now, I host a meeting at 7:30 on Monday night for a number of people. And when I come in, and I just recently started counting the number of papers from the courts that I sign, there's anywhere between 5 and like 15 or so. And that's the meeting that I do at night. But during the other meetings during the day, there's at least that many papers that are being signed for the courts, for KPEP or drug court or whatever. And in a meeting where I signed between 12 and 15 papers, that I've been counting them like kind of recently, in our basket that we pass around to be self-supporting, we would get like $5 or $6. And there's 3 of us that are running that meeting. And so that money is coming from us 3, and the other 3, a number of people, they either cannot or don't contribute because of one thing or another, because of anger, because of they don't have the money, because of a number of reasons. And so we've noticed that in the past, you know, the cost of running a building hasn't changed, it hasn't gone down. And so we find ourselves somewhat a little bit, we're struggling. At times we're above the water, at times we're like glug glug. And so, as Jennifer said, we come down here because we heard about the you guys got cash, okay? And some of that would help us to maintain in a easier, friendlier kind of a way. I was going to say, you know, people come to the meetings, and we as an Alano Club, it used to be pretty much AA, and now it's making a transition to addiction as well as alcoholism. And that is one that, to some people in AA, that they resist that, and other people, the drug court people that come in and have a problem with drugs, they resist that. And so we're in a transitory state right now, but things are, they're working out. But still, again, I'm stumping for a little help from our friends and you guys. And so, okay, now I think I'm done too. With that, I'll pass. Thank you. Oh, 4 minutes, right?
Thank you very much for sharing that. We have any other members of the public that wish to address the body? Dina, do we have anyone online that wishes to make comment?
Chair, there are no hands raised.
All right, thank you very much. Okay, that's going to take us to item number 5. We're going to get a presentation from the Kalamazoo County Opioid Coalition. So again, this is a number of organizations that have been at work for the last 6 years. And we'll hear from Dr. Nettleton. We'll begin our discussion.
Good afternoon. Just again, Dr. Nettleton, Medical Director, Kalamazoo County Health and Community Services Department, joined today with
Kendall Conway, the health educator for opioid response and harm reduction.
So we're just going to share very briefly the history of an organization called the Kalamazoo County Opioid Coalition, the KCOC, the history, some of the work that has been done, the multi-sector partnerships, the current work that has been done, and perhaps some steps that this group could use moving forward. So we'll try to keep it short and kind of open it up for questions as well from this body. So back in 2017, right about the summer of 2017, Diane Schaefer, who is here from ISK, and myself coordinated a meeting, a community meeting at the School of Medicine. We had about 100 members of the community attend. The dean of the medical school spoke, the CEO of ISK spoke. I gave a presentation about what was happening in the community with respect to the drug and opioid overdose epidemic. And that really launched what we now call the Kalamazoo County Opioid Coalition. And at that meeting, we outlined some strategic buckets that we thought we could address as a coalition overall. And those buckets include prevention and education, supply and control, treatment, and harm reduction. So very broadly, the group has focused on one, prevention education. So how do we think upstream about the risk factors that go into the development of a substance use disorder? Getting the word out about what opioids are and what drugs are and what the risks are. You know, the risk perception, even from 5 years ago, is different than it is now as well. So treatment, both on behavioral therapy and also medication to treat opioid use disorder. A lot of stigma around different types of interventions, acknowledging that there are multiple paths to recovering and bringing information to the forefront and building those partnerships overall. Supply and control. In the prior strategic plan, that was a strategic bucket, particularly back in 2017, when healthcare prescribing was a priority, in addition to the decrease of the flow of illicit drugs into a community. You know, back in 2017, a lot changed with laws, Michigan state laws with respect to healthcare prescribing. And the last bucket, harm reduction. How do we keep people healthy enough and alive long enough to hopefully one day engage treatment, and also to decrease the harms that are associated with drug use, including viral infections and also skin infections as well. So those were the broad buckets that the group has focused on. The structure of the group has functioned as a steering committee with a multi-sector partnerships, and it's really been a diverse group. So we've had folks from healthcare, both in terms of private practice, health centers, the hospitals. We've also had participants from mental health and substance use disorder treatment programs within the county, including the opioid treatment program for methadone, buprenorphine, but also from private practice health practitioners in the community as well. Other members of the community include prevention agencies who have attended. The courts have attended as well. People in recovery have been active participants in the KCOC as well. So the structure has had that steering committee develop a strategic plan. And then in between meetings, this is prior to the pandemic that really kind of changed things, was to have these subcommittee meetings focusing on these strategic buckets. And the group, so what's the purpose of the group? You know, this complex, public health issue, and really part of the role of the KCOC was to help reframe for the community too, as a public health issue. The drug and opioid overdose epidemic is a public health issue. You know, oftentimes it has been viewed in a siloed fashion, whatever sector or background we have come from. So one of the purposes of the group was to build those cross-sector partnerships as well. And that multidisciplinary group, and how can those who are at the table in the KCOC work together to coordinate? That's really been the purpose, not to do everything in the county, but those who are at the table, how can we coordinate? How can we not duplicate? We know we have other groups that work in the community as well, such as the recovery-oriented systems of care group, which has a different mission, different purpose. We really thought we needed a focus on opioids, and we can expand now to even stimulants now too. So that's really the purpose and structure of the group. So some achievements of the group prior to the latest iteration. So one has been partnership with our jail, for example, about partnership with our opioid treatment program to allow the continuance of methadone for those who are incarcerated at the jail. That didn't happen previously, and that was the building those cross-sector partnerships between treatment program and those who are at the Kalamazoo County Jail. We've done International Overdose Awareness Day events in the community, coordinated public awareness campaigns as well. We have also had success for members of the KCOC who have advocated for city ordinance changes to enable a syringe services program, a harm reduction program, to operate within the city of Kalamazoo. So those are some tangible results from the KCOC over years. Now, where we're at now, post COVID and everything that really changed in that landscape is recreating a strategic plan for the next several years. That's really how we had success, was those of us who were at the table. How can we create a guiding purpose, a guiding document moving forward? Again, not to do everything, but those of us at the table, how can we move forward together? And that's the document you have in front of you now. This is a working document. This is not a final document. And those who are on the KCOC can acknowledge how laborious this process can be, and maybe feel it's slow, but it really helps us guide where we can go, what can we do together. So that's the document in front of you here. And I'd like to turn over now to Kendall to give just a broad overview and look at perhaps just our goals, maybe a little bit of our objectives, to see where we are now in the status of the KCOC. Kendall?
Thank you, Dr. Nelson. So it has been my honor and privilege truly to be able to facilitate and help guide some of these steering some of these subcommittee meetings. And so in that, I'd like to talk about the specific strategic buckets and what our goals are for that. So the first one being prevention and education. Our group has decided that we would like Kalamazoo to have more education centered around families and community members about opioids and substance use disorder, as well as prevention for that. We want to increase the recovery to support families with substance use disorder. And we also want to destigmatize, the substance use disorder as well. So those are our goals for the prevention and education bucket. And we meet regularly, about bi-weekly, to discuss how we want to go about helping those goals.
Maybe you should just share some of the background work that's been done with the landscape
That'd be
analysis.
great. Sure. So for the prevention and education, we are also doing a landscape analysis, and that analysis is looking at the different organizations of prevention work that's being done in Kalamazoo right now. And so looking at that analysis, we can see the gaps, threats, and opportunities that we need to be able to help put this education into our community. And so that's been really helping with understanding where we need to aim that direction, but also just bringing us together as a team and working together. And so that's for prevention education. The next one we have is treatment and yes.
Thank you so much. I just wondered if I could inquire, what's the time frame look like on the landscape analysis? It's still in process at this time, and
Yes,
what do we-
wonderful question. Thank you. So we started that, I would say, probably in around December, and it has been ongoing. And so we have goals to present that to the next whole meeting, which is going to be on June 4th or June 3rd. So that will be able to be discussed there in its entirety, but it has been working for quite some time. Thank you. So the next strategic bucket we have, of course, is treatment and recovery. And our goal for that is to increase the equitable, timely access to behavioral therapy and medication for opioid use disorder. And this specific goal is what prompted another project, which is our MOUD analysis. And that analysis is also looking at what is happening in Kalamazoo. There are 9 specific hospitals, emergency departments, and other organizations like long-term recovery that we have spoken with. They implemented their own answers. There was 5 questions asking what services they provided, what would need to be happening for that individual to have the best success, the continuum of care. And with all of those answered, we can also look at the entire Kalamazoo County prevention and recovery treatment that is offered. And in doing that as well, we hope to make a list for Southwest Michigan for others to be able to see what is offered in Kalamazoo County. And this would let them see that MOUD is offered here, which kinds of medications they have, what they will have leaving that treatment facility, and the resources that are connected with that. That would be, of course, a document that would be distributed to everyone. So that is for treatment and recovery. And then our final strategic bucket that we meet for is the harm reduction. And for that, truly, we are trying to just reduce, of course, this is all about reducing the overdoses in Kalamazoo County, but we really want to increase the awareness and primarily around substance users, about just the risk of fentanyl, especially. We want to support and expand those harm reduction services and outreach services as well. We are very fortunate in Kalamazoo County to have an incredible person that has been working tirelessly for harm reduction for some time. And I think we all know I'm talking about Miss King. And I do not want to talk about her while she's not here, but she has done some incredible work. And so our efforts are also to really try to help her the best we can too, because she is one woman and she does quite a bit. So that is.
Yeah, perfect. That gives kind of a smattering overpoint of the goals and the structure of the KCOC. What I bring attention to the task force is that, again, this is focused on what we who are at the table can do together. And so this group can have a broader imagining as well, and think about how perhaps best to support some of these current initiatives, but also to imagine what can be done even outside of what's listed here. My personal opinion as our community's public health physician is really how can we really invest more in that equitable access to medication to treat opioid use disorder, investment in that harm reduction practices as well, particularly raising awareness of the risk of fentanyl in those who don't think they are at risk, for example. And then I'd highlighted for the group overall in the treatment and recovery bucket, the issue of transportation that always has come up in our subcommittee meetings and our steering committee meetings about folks who would like to be in treatment, who are ready for treatment, the issue of transportation as being a barrier. So happy to talk about this in more detail, but we wanted to give a brief kind of overview of the KCOC past work and current work. We're happy to answer what questions you may have. Oh, and to our Alano partners, we'd love to have you join KCOC, and Kendall would be our great contact to help facilitate to be part of that group.
Thank you so much.
We have questions from the body. Mr. Gladstone?
Sure. There we go. I would just like to commend the work. I've been part of that group and watched Kendall get things organized. Diane started it off and she did a great job of kicking it off in the organization of the spreadsheets, and Kendall took it to a next level. We had to really narrow down and look at what we can do, because there's so much to be done, and we had to look at and hone in on that. And I would like to commend the work of the group and say, what do we, the question would be, what do we do for sustainability on some of the initiatives that we'd want to continue? Because the money doesn't go on forever, even though it looks like a lot of money, can be eaten up quickly. Was there any consideration, or will we be considering some sustainability issues as we move forward?
Is that a question to us?
Just wondered if we're going to add that to the list to how to make things sustainable, so they're not temporary. Like you give out a bag of bus tokens, you run out of money, you don't have any more bus tokens. How do we make sure that you get a bus token bag a week, every week, continuing? So that's just one, really rough example, but just sustainability, so things that are these great works don't come to an end.
Yep. Within the KCOC, which is distinct from this body, I think about, that continued engagement. And we've had that continued engagement, and that speaks to the group. And so I think the continued engagement is important. If the question is posed to the task force, I think administration, on our agenda today is highlighting funding mechanisms over a period of 3 to 5 years. I mean that for me is a way to frame it for the task force if the question is for that body as well. I do want to bring up prevention one more time. Just a theme. A theme has been the subcommittees and the steering committee, not just individuals, but the family context as well, as a part of a prevention intervention. And part of the challenge with our prevention group has been, on what level and what population to focus on. particularly with youth and adolescents, and in what population and what setting to do that intervention on. And that's why part of that preliminary step to developing those objectives has been that landscape analysis group as well, and some of the outreach that Kendall has been doing as well to some community partners.
Just,
Go ahead, please.
please, thank you so much. Just as we, share and exchange information, it just brings forth some concepts and ideas just to float out into the ether. Attended a Michigan Association of Counties conference yesterday, and there was a presentation from the United Way on their community information exchange. So as we're talking about making that list of providers and services in the community, and I think there's some tools down the line that this task force will discuss that we can utilize to elevate where things are at. Is the United Way, I don't remember them being at the table in the coalition. Do you know?
Recall. I don't remember participating in the past.
So I'm just I think that might be a good partnership there, because there's an opportunity to utilize 2-on-1 as a connection point for people seeking services and programming, and even some opportunities for data sharing across the system, where we can take sort of like one intake information and then allow that to be shared across partnering organizations through the United Way. So I would elevate that. The other related to transportation, and maybe we can have some future dialogue at the coalition level or here in the task force. Metro will be meeting with our county board around their strategic plan over the next several years. And so this is an opportunity I'll use to elevate that in dialogue with Metro around what collaboration can we do with the location of some of our providers. I know Nancy King had elevated their new location is not, conveniently located to public transit. And so we're opportunities that we can bring the transportation sector in to problem solve with this. So just elevating that. Any other thoughts, or Dr. Nettleton, what else did you have?
Just a final comment. I'm fortunate to also participate as medical director of Calhoun County as well, and part of their coalition and their Opioid County appointed task force. And just to share, a different county model has been to look at their local coalition, meet with the task force, and actually prioritize within the group what the task force's individual priorities were. And that was a way to kind of parse through for their body about where to proceed on possible next steps at that level. So again, brings in some of the coalition input, and then has outside partners, again, some of that reimagining as well. But it was a mechanism to have and see what tangible steps can be made forward for a body who is advising these decisions that are being made about some tangible next steps to be taken.
Thank you so much for the presentation and the work that continues.
Great,
Hopefully
thank
I'll
you.
be able to join at our next strategic meeting. Any other thoughts or comments here? Okay, all right. Next, we're going to move into discussion. So we had some dialogue around question 2 and didn't really get far into question 3 the last time that we convened. So we're really looking for, what would by priorities we want to suggest to the county board in concentrating funding for opioid remediation in our next 3 to 5 years? And what funding categories do we think should be created based on our community needs assessment? And so I wonder if it makes more sense for us to maybe dialogue a bit around question 3 first. So what are the buckets, and then what are the priorities within those? So I welcome any thoughts or comments from our members. Sheriff.
Yeah, so under number 3, number 3, I want to remind everybody that the jail is one of the locations that sees the highest number of people who are suffering through a substance use disorder in our facility and one place in the community. And I'd like to make sure that our conversations always go around the idea of maintaining a MAT nurse as part of the staff of the jail.
Sheriff Fuller, can you remind me, is that the position that's already being funded currently?
It is. It's not a
Okay.
new position. It's just a
So you're
continuation.
just
of what I'm-
asking for perpetuity of that,
Yep.
of that revenue stream?
Yeah, exactly.
Mr. Gladstone.
Um, I would propose that we look at the three strategic remaining bucket groups that were just mentioned, prevention, treatment, and harm reduction, as perhaps broad categories that would, because easily any of our funding could fit into. So I would propose to the group that we vote that in as a, I don't know if we're going to vote on it today, but that we vote that in as an avenue for pursuing. Thank you.
Thank you, Mr. Gladstone. Do I hear any consensus or comments? You want to go ahead, please?
I was going to agree with Dominic on that, and I can speak for the prevention and education group. Prevention Works, we do a lot of prevention as well as interventions, leading individuals to treatment. But we're seeing younger kids accessing substances at a lot younger age and a lot of mental health. And so it's really important that we are working directly with the families as well as the youth in the middle schools, elementary schools now, a lot more than what even Prevention Works is able to do. So I know more funding coming into that bucket will be really important for future years.
Commissioner Morales.
Thank you, Chair. I have a question for Sheriff. So that nursing position, is that just one? And what are the hours like? Because I'm sure you get people 24 hours a day. So what does that look like?
Well, that would be one nurse, but they work in conjunction with the 5 other nurses.
Okay.
And ultimately their work is dedicated towards this. But if there's something set up that say the person in need would need something on the midnight shift, things would be put in place by other nurses to actually handle that at the direction of our doctor and our MAT director.
Okay, thank you.
Mhm.
All right, so do we generally have consensus to consider prevention, education, treatment and recovery, and harm reduction as our 3 strategic buckets, rather? Pretty straightforward. And they're in the stipulation of our settlement agreements. It really identifies these are the focus areas in which we're allowed to spend, or we're required to spend the majority of our funds. So then thinking through the buckets, we have the strategic sort of initiative being discussed by the coalition. Where else do we see priority funding in the next 3 to 5 years? So I've heard, continuing the funding for MAT treatment in the jail. I've heard that continued funding for outreach to families, for youth, for opioid and substance use education. What are other priorities that this task force wants to elevate in the next few years? Director Rutherford.
We've been having a lot of conversations relative to centralization of information and some type of data hub and some one spot where people can go for referral information, for current data information, for different programs. So obviously, I think that that's really some low-lying fruit that needs to be considered and developed and housed somewhere, so that we assure that I think we're all kind of feeding into the same repository for that information.
Chair Ray.
Thank you, Chair. When I looked at the report, I saw there were a lot of barriers. I think we should focus on addressing some of those barriers. Some of them have already been mentioned, like stigma, but then things like transportation, navigating resources, affordability, things like that. I also think in addition to prioritizing the youth, we should also prioritize pregnant and postpartum women as well as treatment for infants. And then also supporting some of the recovery groups and sober living facilities. Thank you.
Thank you as well. Mr. Gladstone.
Thank you. A lot of good points made already. I would reemphasize two things that I brought up previously, which was reward for collaboration. Oftentimes a lot of nonprofits operate in a silo because they're competing for the same dollars. And I've seen it for decades. What we need to do is incentivize true collaboration. An example of the collaboration without regard for money was when Gwendolyn Hooker and Nancy King got together and started distributing Narcan during the fentanyl crisis we had, what was it, a year ago around Halloween or something around that time frame. They just joined forces quickly, advertised these pop-up Narcan distributions and got it out there to the public without regard for who is doing a better job at it or who's in charge of what, which oftentimes happens. Nonprofits get very competitive. And we need to figure out a way to incentivize true collaboration like that to further our efforts so that prevention is working with treatment to do handoffs when prevention is not working and somebody's in active use and they want to get help, that they're passed along nicely to treatment, just things like that in the funding that incentivize it. So I don't know how we would write that into it, but perhaps when the grant offerings, maybe they get a bonus if they collaborate with another grassroots organization. And that leads me to my second point, which is looking at the smaller grassroots organizations with low barrier funding. What I mean by low barrier is it's easy to get. There's not 20 pages worth of SAMHSA recording needed to, every month to make it happen. It's a simple 1 or 2 page application, a simple reporting method that could be even a verbal meeting for 15 minutes to say, hey, how's it going? Make it low barrier for the grassroots people that maybe only have 1 or 2 employees and no director of development to work on grants. The Allen Club is fortunate to have a volunteer grant writer on board, but a lot of small grassroots organizations don't have anybody to write their grants. So the low barrier funding, the reward for collaboration would be 2 things I'd like to put on the radar. Thank you.
Thank you. Dr. Ford.
Well, I think like Sheriff Fuller mentioned how many, in the jails, we see a lot of people with substance use disorders, and I definitely think we should continue to support the M18ers, but it kind of brings to mind the other place where we see a lot of people with substance use disorders is the emergency department. And we don't have obviously we have a lot of nurses and we have staff, but we don't have dedicated staff for improving care with our patients with substance use disorders. So we don't have that at either health system in town. We don't have any addiction medicine consult service for inpatients. The healthcare environment is a place where people are often at their worst with their substance use, and it's a place where we should be engaging with them. And our hospitals, they need some support for this too. We need a little bit of dedicated funding, and we can do a lot with it. We did a lot with that, with our EDMOUD grant in 2023. It was focused initially on treatment, but like we're talking about here, these 3 things, prevention, treatment, and harm reduction, they need to flow seamlessly between each other. We can identify families that need intervention on the prevention end and in the healthcare environment, and we certainly have been integrating harm reduction. And we're moving the harm reduction out into the community again. We've partnered with Nancy King and ISK, where we're developing our naloxone leave behind program with Life EMS in Kalamazoo County. So there's been a lot of good things as far as collaboration. I've met a lot of people in this space since we got that grant, and everyone's so thrilled to be, when we would meet about the EDMOUD and the follow-up patients needed, they all got a warm handoff. They all got a prescription for buprenorphine for 7 days, and they got a warm handoff to a place that was going to keep taking care of them. And they had recovery coaches come from ISK to, walk with them if they needed that. So it's just an example of how we can continue doing this, but there are some things that Or if you look at organizations like the Alano Club, thank you for coming to talk to us, like things that are already in process in our community that just need a little bit of support. So I agree with Dominic, easy to access, not difficult, not difficult application processes, et cetera, and support some of this stuff that's already in process while we work on building new things.
Thank you. Mr. Gladstone.
I have a question, not necessarily related to this, but the money in general, and we do have some of our commissioners here. We've got at Kalamazoo County a great team of finance people and investments and so forth. Is there a way to, going back to the sustainability question, is there a way to create some sort of a peel off of some of the money to endow it over a period of time so that it doesn't disappear? So you don't just use it up. Is there a way for the county commission to create an investment fund as many of the foundations do, so that they can distribute funds indefinitely with investments? Just thought I'd throw that out there. Obviously, we're not going to fix that one today, but once again, putting it on the radar for discussion amongst the county commissioners.
Yeah, thank you, Mr. Gladstone. I think generally, as far as the current awards, I think we would be precluded from investing these dollars directly, but within, broader the county budget and really being strategic as this board enters into our next strategic planning period, I think those are discussions that we can elevate there. So thank you for that. Right. What about from others? Director Bobo, do you have any priorities or suggestions you want to elevate?
I like Mr. Gladstone's buckets from Dr. Nettleton. I think they really incorporate the full stream of problems from the very beginning all the way through, as everybody talks about, handoffs through the system. So I think that's really where we should all be focusing our efforts because it's a follow through from beginning to end. So I don't really have anything additional.
Dr. Nettleton.
I just want to reflect about Dr. Ford's comment about the need for a addiction medicine specialist in the community. We have folks who are definitely prescribing, take care of folks who have lots of different types of substance use disorders or addiction, but to have a dedicated, sustained addiction medicine physician, that's a gap in Kalamazoo County and in Southwest Michigan in general.
Sheriff Fuller.
I wonder if that's something that Western Michigan University School of Medicine might be able to take on as a role, funded or otherwise, but that might be something that would be good for them as well.
I could definitely reach out. I think there have been discussions about the idea for that, because to have a medical school in the community, to have someone who can be trained in where you train predicts most likely where you'll practice. And so that's one thing I could reach out about and see what possibilities are there.
Thank you. Any further discussion? What time are we at here now? Moving into our last few minutes of our time together. Right, so thank you for sharing some initial thoughts. We'll have more opportunity for discussion. Let's go to item 7. We just want to think about some strategy about how to effectively move through some of the future questions. So we're looking about recommendations for community-wide prevention and education campaign. Is that needed in the community? So here, would it be helpful as we have discussion around that item to get a presentation from HCS or others, or are there other folks that we'd like to bring in to have discussion with us?
Restate the actual question, because you were talking about strategy to discuss. We're
Yeah.
not discussing. So please clarify.
Thank you. So what I want to do is help this body have the information it needs to make informed discussion occur around these future questions. So if you look at our agenda items, for item 7, there's just a suggestion that maybe we want to request a presentation from HCS around prevention and education approaches, or we could invite other partners like Prevention Works and hear about what it is that they're doing around the space, just to help kind of inform our discussion. We could not do that, and if we feel like we have a sense of what's needed, just engage. So we just want to kind of think of through strategy. So again, for question 8, that one is about the county-wide alert system and how we collaborate. And there were some recommended considerations for presentations, including the sheriff's office or the emergency manager's office. Let me take Dr. Nettleton and then we'll go to Gladstone.
I could present on question 8 and what the process has looked like in both counties I've served when an overdose cluster event has occurred, if folks are interested.
All right, thank you. Mr. Gladstone?
Thank you. I'm going back to question 7 then, and I'm wondering, SWIMBA, Brad Casemore, CEO of SWIMBA, has a lot of contacts around the state with his other counterparts. I wonder if there's a stigma reduction campaign being done in the state of Michigan elsewhere, as we do have the Zoom, virtual meeting option. We could have somebody present that's having success somewhere with a stigma reduction campaign and just give us a brief synopsis of what they're doing and why it's successful, and look at that as well when we're talking about stigma reduction. Because we brought that up several times throughout. I believe Mr. Gray mentioned it at the last meeting. I've been talking about it for a while. It's one of my big platforms. So I wonder what's working elsewhere, and could we get a presentation, and maybe reaching out to Brad and asking if someone's doing a good job at it. Thank you.
Okay, thank you. Sheriff Fuller, did you have something as well?
I was just going to mention on number 8, we're already talking to our emergency management team about what it looks like. And again, Dr. Nettleton's fully aware of those things. So he pretty much said what I was going to say.
And then what about any others that we want to consider dialogue with around question 9 about locations of accessible points for Narcan distribution? I know, we've heard about Cope Network and Miss King a number of times. So I don't know if that would be good dialogue. Sheriff Fuller.
So you might remember the sheriff's office has a machine that we give out at least 40 a month. During the minor epidemic that we had last year around Halloween, we ended up giving out 70 that month because so many people were aware of that situation. And so when they left the jail, and again, this is only for people that are in jail, leaving jail, we are exploring with the courts, and we believe that there's a couple of different court buildings that might be great locations for this. And so we're currently trying to locate those, and also with other police agencies.
Thank you for that. Chair Ray.
Thank you, Chair. I think those are all really good suggestions. I would like to hear also from some community organizations to know where they need to be in the community as far as like where folks are that are using, and how we can, have them really close when people need them as well, in addition to, some of those larger organizations.
Dr. Nettleton.
This isn't on the list of questions, but I'll just pose it to the group and to you. The idea for a specialist in transportation, perhaps, to present to the task force. I don't know, from Metro or from the city or from otherwise, just to get a lay of the land. Like what is the logistics? What are the barriers? What is the current status of transportation issues for Kalamazoo County, and particularly around treatment access, for example?
Take Director Rutherford, and then we'll come back to Sheriff.
So I'm going to change the flow a little bit because of bureaucracy. And I know that that's a wet blanket on a lot of conversations, but process is going to become important at some point in time. At some point in time, this committee is going to have to finalize, these are the buckets that we're in, and you're headed in that direction. So that's encouraging. but you're also going to have to formalize, what do you want to see done? You're going to have to recommend some, there's going to have to be a development and RFP process if you're going to allocate funds. And so the process is, it's unattractive, it's necessary, it's bureaucratic, but this isn't even the final decision. The Board of Commissioners are going to be the ones that are, the final deciders on how to allocate this revenue. There's a lot of nonprofits in this community that do a lot of great work. There's going to have to be oversight. And we've learned this with programs like, AAA. We've learned it with the Veterans Program. We're learning it with housing millage dollars, where we have to be able to go in and say, did this organization accomplish what they said they were going to do? So there's process that, again, it's unappealing. I love the idea of looking at the jail and our emergency room, because if there's a come to Jesus meeting, it's going to be in that environment. I think that's when people are at their most vulnerable, and that's probably when they're most likely to say, I need help. So I hate to be the government guy, but that's what I've been doing for my whole life is government. And I know how process works. I know it's, people look at it and say, God, that's just, cumbersome, and it deviates from what we're trying to do, but we really have to be mindful of getting to that end zone. And that's part of the discussion along the way.
Yeah. Well, and I think on that note, Director Rutherford, I'll just elevate. I think it's just an opportunity to figure out how we partnership that administrative burden with the community organizations, just to provide them the support in some mechanism. And I want to elevate for any of the task force members, if you haven't had a chance yet to explore, Deputy Administrator Smith provided us a link to the Osprey tool. And so if you go in and you can look at, you could take, for example, some of the action items proposed by the coalition, and you can drill down into data about what type of metrics we might consider to use to evaluate whether, if we're using that particular approach, how effective is it, and see from data that they've collected across the nation, what elevates as responses that kind of have more impact. And so I think there's a way for us to kind of, hopefully, in a magic world, do both, satisfy the bureaucracy and oversight and provide the support to the community-based organizations. Did you have something, Commissioner Morales?
Thank you, Chair. So to your point, I think it's important that when this comes to the board, that we streamline this, because then we'll have people that are not here will have questions. So when we put this in order, I think it's important to take everything that we talked about into consideration. Chair Ray had a lot of recommendations about the barriers. So I think when we talk about metrics, we are going to have to decide here who we want to bring in, collaborate, who fits best. If incentives are in place, that's fine, but really, we shouldn't need incentives to help people. It should be a tangible handoff, and we should just be doing the work. I do agree that with the emergency room and the sheriff's office, that is your most vulnerable, but also with small organizations, with folks that are on the street, that are in the middle of the night, just walking in saying, I need help. They need to be able to have funding. So I think we need to be really clear on our decisions we make here, how we allocate these funds, and how we keep them coming in perpetuity, so that we don't have to come back to the drawing board. But again, when this comes to the board, it needs to be clear, so we don't have to come back and forth and answer these questions and make a sound decision.
Mr. Gladstone.
Thank you. That's a really good point, and it brings me to something that we have a lot of in 12-step recovery, which is guidelines for how we do stuff. And perhaps part of our end report is a set of guidelines created so that you can check boxes when you're going through this. And if there's a commissioner who's not as familiar with the information as perhaps Commissioner Strebs, who works in the business, that they could look at this and a set of guidelines that we create as part of our end product, our deliverable as a task force, not just answering these questions, but going beyond that and putting together a set of guidelines. So we're not speaking in generalities. For point of communication, just to make it clear, the incentives that I was talking about was for collaboration only because of the competitive nature of grant making. So just to make that clear, it's not, we don't need to incentivize what we've got a public health crisis dealing with and so forth. Some things don't need any incentives, but collaboration among small agencies to work together. Also, I had brought this up to Chair Strebs, Commissioner Strebs, about us evaluating the grants as part of the process. That would be further work continued above and beyond answering these questions. That when the grant applications come in, it goes to the task force first. We all read them and we rate the grants. I've done grant rating before for the Arts Council and other organizations in town. You just read through them. This is on a scale of 1 to 5. Just rate them real quick in different areas. Do they fit? And then that gets passed off to the commission. By the time it comes to a vote, you at least have consensus to deal with amongst ourselves. We've got a lot of smart people around this table. Thank you.
Thank you for that. So it brings us, we are at our time. Again, on item 8, I lifted up the Osprey tool already, so I encourage members of the task force to take some time to explore that if you have the opportunity to do so, and also the opioids website from the Michigan Department of the Attorney General. There are additional tools about sort of what's happening across the state. Do we have any additional comments to share today? I think we have some framework about some presentations we'll request for future meetings. Dr. Ford.
Just super quick for question 9, if you could get it on the list. Like I did bring a list today of Nancy King's existing boxes she provided me with for as far as naloxone distribution and they're at community organizations. But I think for that, when we have that question, if we could invite her here and some of our team from WMed that's working on the EMS Leave Behind program, and also we're increasing kit distribution in the hospital. So I think that would be.
Thank you very much for elevating that. Further, Mr. Gladstone?
Just a quick announcement. The UFAM rally, the annual rally in Lansing is on May 16th. That's an all-day rally on the Capitol Lawn in Lansing, Michigan. And a lot of the recovery community from around the state comes together, and we advocate for changes in government and support in the continued effort in the public health crisis of addiction. So UFAM rally, May 16th, I think it starts around 10 a.m. or so, runs all afternoon into the afternoon, if anybody's interested.
All right, thank you. All right, I see with nothing else before us that we are, oh, I'm sorry. Yes. Deputy Administrator.
All right, thank you. I just also wanted to make sure I highlighted the other additional resource, not only the Attorney General's website, but specifically included in the packet is the breakdown of what Kalamazoo County is anticipating to receive per calendar year of the settlement funds. So as y'all are looking at and we're prioritizing, I'm taking notes, and pretty soon I'll have some compiled notes for y'all to look at to make sure I'm hearing what y'all are saying for each of these questions. But as we really start to dive into some more of the meat here, for y'all to keep in mind the annual allocations that we anticipate receiving. Thank you.
Thank you very much. All right, with nothing else before us, appreciate all of your work and dialogue. We are adjourned.